Patients ask me this all the time. Doctor, how can you be out of network when you do the exact same surgery? It sounds like an administrative details. It is not. Because once you zoom out, something uncomfortable becomes clear. Modern healthcare does not reward skill, it rewards ownership. And in a system where hospital own the buildings, the referrals, the contract, and the insurance leverage, anyone independent becomes expendable. That's why private surgeons aren't treated like partners, they are treated like stepchildren. This is the main problem. Healthcare system publicly say they want access, they want quality, they want a competition, lower the price. But in practice, independent surgeons are often excluded from networks, paid less for identical work, labeled out of network by default, buried under administrative barriers. That contradiction is the problem. And this is the clear truth. Private surgeons train in the same programs, hold the same board certifications, perform the same operation, carry the same malpractice liability. Independent does not mean unregulated. It simply means not owned. But in modern healthcare, structure often matters more than skill. It's like two pilots flying the same plane, but only one is allowed to use the airport. Same training, same responsibility, different access. Let me tell you about the monopoly mechanism. Hospitals today are no longer just place of care. They are employers, they are facility owners, referral gatekeepers, insurance negotiating giants. This vertical integration creates leverage, and leverage creates control. Independent surgeons are not excluded because they are unsafe. They are excluded because they cannot be controlled. This is paramount. They don't feed internal referral loops. They don't generate facility fees. They don't strengthen the system bargaining power. So the system does what monopolies always do. It squeezes the small players. Not because they are competition, but because it can. Here comes the false competition myth. Patients are told they have many choices, but often different hospital names, same parent corporation, same contracts, same pricing, same referral ecosystem. What looks like a competition is frequently just buildings owned by the same system. So, what's the network illusion? Networks feel like recommendations, but most of the time they are just defaults. No one ever tells patients they can see an independent surgeon. They are simply never told one exist. That one sentence explained years of confusion. Just follow the money. Hospitals negotiate insurance contracts as billion-dollar system. Private surgeons negotiate alone. Same work, same outcomes, different leverage. Insurance companies don't pay more for quality, they pay more for size. That's economic, not medicine. And this is the icing on the cake, the facility fee. Often the extra cost is not the surgeon, it's the building. Same surgery, same staff, same anesthesia, different address. A facility fee appears, not because care improved, but because ownership changed. Don't forget that. So, what's value versus payment confusion? Private surgeons are often paid less, not because they deliver less, but because they don't belong to the system that controls access. Lower payment becomes mistaken for lower value. It is not. So how hospital eliminate the independent surgeon using the administrative weapon? So modern healthcare rarely eliminate independent surgeons directly. Instead, it buries them under prior authorizations, repeated documentation requests, delayed approvals, endless credentialing cycles, payment denials over technicalities. Large systems absorb this with departments. Independent surgeons absorb it personally. Survival becomes exhaustion. So what happened in real life? Patient experience fewer choices, higher out-of-pocket costs, longer wait times, forced referrals, out-of-network surprises. Surgeon experience contract exclusion, financial pressure, administrative overload, incentive to sell practice, pressure to become employee, and slowly, quietly, independence disappears. Not by law, by economics. I want to say one word about liability. Same surgery, same risk, same lawsuit. Accountability does not change with employment, only payment does. So what's the future cost and why this matters? When independent medicine disappears, practice anchors vanish. Transparency dies. Negotiation stops. Innovation slows. And when the last independent option disappears, prices are no longer negotiated, they are dictated. As a surgeon who has practiced both as an employed and independent, I've seen this from both sides. The surgery does not change. The patient does not change. The outcome does not change. What changes is who owns the building and who controls the contract. In many countries, independence is normal. here is treated as a suspicious. So the question that the patient in my mind should ask is, when the same surgery costs more, is the higher price buying better care or just a bigger system? This is not about rejecting hospitals. Hospitals save lives every day, but monopoly should never replace medicine. When healthcare rewards sizes over skill, when ownership matters more than outcomes, when independence is punished simply because it lacks leverage, patients don't win, doctors don't win, only the system grows. And that's how monopoly quietly eats healthcare from inside. This is Dr. Drbenmaamer. Follow for clarity, not noise. So together we can build momentum and change healthcare in America.